I have a singing voice too, so I might get really loud. So I'm Nancy, and as John said, Isabel, and we'll share a little bit with you about what we're doing. But we're both healthcare providers in Alberta Health Services, and we're invited on behalf of the new CEO, Mrs. Vicki Kaminsky, to step away from our jobs and our roles and look at the continuing care system. I appreciate John's comments about it's about mothers and fathers and brothers and sisters and aunts and uncles and husbands and wives and neighbors and family members and just that whole language. For Isabel and I, this has been a bit of a personal journey for us as well. Because we have had parents or currently have parents who are in the continuing care journey, not in Alberta, but in a couple other different provinces. And so we're also coming from a place, I think, where we're not walking in your shoes and we're not walking in the people that we've spoken to, but we really are humbled by the opportunity to look at this at the system and to talk to many of you. So those are my opening comments. I'll have Isabel open her comments, and then we'll walk you through a little bit about our mandate, what we've learned, what we do are suggesting we need to do some more work on, and we really do want to hear from you. And so those handout sheets that you have hopefully will facilitate the discussion, get your feedback. We don't have all the answers. We're only stronger when we invite people to tell us and give us suggestions and answers. So we hope that that will be a good starting point for this afternoon. And if it's okay with you, we'll go through our presentation and then making sure that we engage you in the discussion and do the clarification if that would be okay. So I'll turn it over to Isabel.
Okay, I'm going to start off the presentation with a story. Okay. Yeah, so this, as Nancy said, we've been seconded for a 6-month period to work on studying the concerns that have been coming in around continuing care. We started our journey on July the 7th, and we will finish in early January and go back to our regular positions within Alberta Health Services. There'll be a few bits and pieces that we're going to carry on because we want to make sure that things are tied off before we totally leave. But it's been an absolute privilege to have the opportunity to speak with. We'll be giving you some metrics later, but I think we've spoken to almost 900 people so far. In terms of the concerns that have been coming in, we've got about 3 to 6 concerns per day that have been coming in on the Health Link line. And I have information if you don't know how to access that. Most of them come in by phone, a few of them come in by email. So we've been using the regular operational channels within Alberta Health Services to assist us with in resolving the concerns. About half of them have been resolved. There's still some outstanding. But I want to start off with a story. And this story came to us very early in the secondment. And it was about a particular woman who lived in a rural area in Alberta. And her daughter, who lives in Ontario, had written a letter to the minister about concerns that she had experienced with her mother's care, in continuing care. And in speaking with the daughter and then subsequently with the daughter-in-law, it became very clear some of the issues that we have created in our system that create big obstacles for our clients and our families in the system. So this particular woman was admitted to long-term care. She was diabetic, she was blind, she was very heavy lady, and when she was admitted, the intent was that she would continue to be mobilized as much as possible. So, encourage her to walk as much as she could. Unfortunately, that did not happen. She ended up spending a lot of time in a wheelchair, ended up with a pressure ulcer, and then in subsequent days and months around dealing with that pressure ulcer, there were problems with communication, information that didn't get transmitted effectively to her physician, to specialists, etc. Equipment that didn't arrive on time, sort of breakdowns in communication. The woman actually spent a lot of time, she was very cognitively intact, unlike a lot of the residents in that particular facility. And she spent a lot of time on her own, and she could hear, because she was blind, she could hear other people talking, and she really didn't feel included. And the comment that she made to her daughter was, she just felt like a thing. And anyway, at the end of the day, the client passed away, and her daughter wanted to make sure that some of the issues that she'd experienced with her mother's care didn't happen to other families. And we spent a lot of time on the phone in discussion with with the daughter and with her sister-in-law who lives in Alberta. And this is just sort of a wordle that we created that kind of, I think, resonated with the themes that we heard. There were issues around prevention. You can see there that if there had been proper attention paid, getting this woman mobilized, keeping her active, probably wouldn't have had the same issues around skin breakdown. There were issues around inconsistency, issues around staffing, not picking up on things, not passing communication effectively, and excuses that were provided to the family around some of the problems that had occurred. One of the comments that she made was that there were just some wonderful volunteers, and her mother really appreciated the wonderful volunteers who came in every single day to this particular facility. And those volunteers felt that this facility was part of their community. They really were so committed. And that certainly was something that made a big impact on the family. And you see that word "thing." This client really felt in many ways that she didn't feel that she was being included, and so that was something that was quite disturbing. So at the end of the day, we did make a commitment, and this family is going to work with us as we bring forward our final recommendations. They'd like to review them and provide their input. So we want to make a commitment to that family that those issues that their mother had experienced aren't repeated.
So our mandate, what we've been asked to do, is to provide a really high-level scan of the current state of home care, supportive living, and facility living. So when we're talking about continuing care, that means all those three sectors across the province. We're also, as Isabel mentioned, a concerns line through HealthLink was launched. It's 24/7, and we do have the contact. You can contact it by phone, 1-800, or through an email. And so part of our mandate was to also monitor, look at the concerns, work with the operational folks, work with families to, as best as we can, ensure that answers to questions, any issues or concerns that were raised would be responded to in a timely manner. And so that's part of our role and responsibility. The third mandate was to connect up with families, with clients, with patients, with residents, with groups like yourselves, associations, many people across the province. And so part of it was to engage and talk and listen to what you had to say. And then the final mandate for us was to make suggestions to identify strengths, so where we see there are pockets of really good work or really good things that are happening that maybe aren't happening across the province that we need to leverage off and learn from, but also to look for opportunities. So things that maybe we need to pay a little bit more attention to, put some processes in place, have further engagement in discussion with folks like yourself. So that was our mandate. To date, as Isabel said, we've probably reviewed over 400 concerns, whether they have come through email or through the 1-800 line through HealthLink. And we've also met, probably we've done about 130 group interviews, individual intergroups, have gone out and met personally with families. And as Isabel said, that's over about 900 people to date. We also have the opportunity to review and hear some of the, just, you know, on the street, or we're talking to somebody in an elevator, and so we're picking up a lot of really, really valuable information from there. So as I mentioned, the streams of care that we are looking at is home care, supportive living, and continuing care. And we needed to make this really clear up front, because people thought we were just talking about nursing homes or long-term care. That is not the case. We're looking at care across the continuum. So why is the burning platform? We have really shifting demographics, as we all know. There's a lot of us in Alberta that are not moving someplace else to retire. We're staying here. There's lots of us that are leading healthy lives. We're interested in becoming part of groups. We have a social network, so that's one of the things. Our changing communities. We've heard loud and clear. You can't put a city model in a rural community, and you can't put a rural model in a city community or an urban community. And the folks in the community would say, it's not about staying in my home, it's about staying in my community. And when we talk to some of the folks in the urban settings, like, you know, Calgary, Edmonton, Red Deer, Lethbridge, Medicine Hat, Fort McMurray, Grand Prairie, some of those larger centers, they're saying, you know what, it's important for us to be able to, where possible, to stay in our home. And if we can't stay in our home, to stay in that home community, so the community around me. So we know we've got changing communities. The other thing is that we've got many, many people with complex conditions. They're just not coming with a diagnosis of dementia. They're coming with dementia, plus maybe congestive heart failure, plus maybe diabetes. And so we can't look linear at an individual. We need to look at the whole spectrum of needs and clinical needs that they may have. But we also have to look at their social and their emotional and their spiritual as well, and to ensure that we integrate and ensure that we're including the family and that it's a community of care. So that was another burning platform for us. The final thing, and it's not an exhaustive list, but that continuing care is more than seniors. And what we have found is that we have the highest occurrence of dementia, early dementia in Canada, here in Alberta, of those under 65. So we have an early dementia population, or cognitive impairment population, and these are families that maybe have young children. Both parents were working outside the home, and now one is not able to carry on with their work, and so then lots of stress, lots of challenges from an emotional perspective, but also from a financial perspective. Same with some of our those over 65 as well. But we also have a high incidence of autism. We have met with people with MS, that are paraplegic, quadriplegic, so not only the physical and the emotional, but even people with mental health. We've got a population that's really is needing to access the continuing care system, home care, supportive living, and facility living. And so how do we actually hear their voice, listen to them, and try to move to make changes in the organization, in our system?
So very early on in the secondment, we identified that there were sort of maybe 6 themes that the concerns were sort of falling into. So we'll talk a little bit about each of the themes in a few minutes, but these are they. So access, so we'll give you some examples in the coming slides. Quality, facilities. Facilities, we thought we would have a lot more, but actually it turned out that there aren't as many that come to us around facilities. Communication, transition, and other. So the first one that I'd just like to overview for you. So we've heard lots of issues around access. So how do I navigate the system? It's so confusing, so complex. I just don't know where to start. So access is a big issue. How does it work? Who do I call? Even care providers working in the system find that it's so complex. Access around waiting for information. So they've requested some information, and it's just taking too long for someone to get back to them. Also, access issues around waiting for a bed. That is a big concern for Albertans. The second area that we've had concerns around is related to quality of care. So a big one has been responsiveness to call bells. So my mother, needs to go to the bathroom, and she's waiting too long before someone answers the call bell. Help with activities of daily living. So toileting, hygiene, bathing. Feeding is a big one as well. So just, my mother is unable to eat by herself. She needs help, and there's just not enough support for her to get a nourishing meal. Psychosocial and emotional support. Goals of care is another one as well. In Alberta, we've initiated the Goals of Care initiative, so that clients and families have the opportunity to identify what their goals are and sort of what measures they wish to have taken to support them towards the end of life. And there is sort of a process that we have established in Alberta Health Services, but we've identified that actually some of that is not happening as smoothly as we would like. And families get to a point and there's a crisis and nobody has discussed with them what their plans are, what their wishes are. So, we're often making decisions at not the best time. Wound management, another issue, pressure ulcers and whatnot. And then other issues related to quality include complex care, and particularly knowledge of how to look after someone with dementia, that there could be better care, better training for our staff around looking after clients with dementia. The third area is around communication. So it's kind of been this topic that has been taboo in many families. We're not open often with our children about what our wishes are. We kind of leave things till the wheels fall off. And we need to start that conversation early. We need to get the conversation alive in the public domain. We're all going along this journey, and we need to be upfront about it and start planning and making our wishes known. People want a timely response to their concerns. They, make an inquiry or register a concern. It's just taking too long for people to get back to them. There's, a reluctance to share concerns. People are feeling that if they complain about the care that their mother's receiving, that in some way their mother's care is going to be impacted. So they're afraid to come forward to express their concerns. That's what they're telling us. The other thing that we've heard from people is that families are living remotely. Perhaps the daughter is living in Ontario and the mom is living in Calgary, and there is care planning that's happening in the mom's facility, and the daughter would like to be involved, but there doesn't seem to be an effort on the part of the care team to include family members living remotely using Skype or even teleconferencing or FaceTime or whatever. So the children of these folks are saying they really want to be involved, and we need to make a better effort to include family members. And then the other piece that we're hearing is around conflicting or lack of information. And again, it's kind of that enigma around continuing care. And there's no kind of single source of truth. And we know it's complex, but people are saying you could do a lot better job of trying to simplify how this system works.
So we'll continue on the kind of the themes. So the next theme is around transitions. And what we've heard is delays in referrals. So has the referral gone in? I've asked that my mother or my father or my brother or sister be assessed for a higher level of care, or to even get on home care. And so there have been delays in the referral process. We've also had lots of requests about the process to transfer between our zones and facilities. So you might be living in the northeast end of Edmonton and you really wanted to be in the southwest part of Edmonton. What's that process? How do I facilitate that? And as Isabel mentioned, we've also have a lot of requests to transfer between zones. So as you know, we're organized into 5 zones. So I live in Red, my mother lives in Red Deer, I live in Calgary. I'd like to have my mother move to Calgary. Why is it taking so long? What's the process? And so we have heard concerns and questions about that. And then the too many moves. So, we can't find the right place for you right now, but there's kind of another place we could send you to or place you in. And so we find that we're doing a lot of different moves. It doesn't happen a lot, but it does happen occasionally because different levels of care are provided in the different levels of the continuum. So supportive living 1, 2, 3, and 4, and then long-term care or facility living. So trying to say, how can we actually reduce those moves and try to provide the care and not have to move you to a higher level of care. And then how do we actually get to the right care, with the right provider at the right place? As Isabel mentioned, we did have a few concerns about the facilities, and we thought we'd have a lot more. So again, these are provincial themes, not just specific to Edmonton, but I would say that they would be pretty consistent across all the zones. But we've heard things around the temperature of the facilities. Some of our facilities are aging, and therefore they don't maybe have air conditioning units that can support them, so we have lots of fans, especially in the summertime when we have that heat situation. Food. What we've heard about some of the things about food, not so much about the quality, but could you please offer my dad a second helping? He'd like another, second helping of mashed potatoes. Or just making sure that the consistency is appropriate for what he's able to intake. So again, there's been a few things around the food, but there's been quite a few surveys, satisfaction surveys that are being done. So I think the teams are really trying to ensure that they actually are able to make some adjustments to the food. The cleanliness of the facility. You always kind of know a facility by the sniff test. Well, what does it smell like when you kind of walk into it? And so we've had very few concerns about the cleanliness of the facility, and again, ensuring that people know what's the right equipment, the right solutions, how often things should be cleaned. But we have had some concerns about frequency of housekeeping, the quality of the housekeeping. And then the home-like versus institutional. This came through in some of our rural areas where they have been able to repurpose some of the acute care hospitals and make more into a long-term care or continuing care facility. And because, again, they may not have had the money to refresh the facility, the families have said, if we can have some rooms, a congregated dining room for people, a place that we can have a quiet family meeting or a quiet birthday party. And so they're just saying, how could we make it a little bit more home-like, so forth and so on.
So I wanted to talk a little bit.
Oh, you can finish that one.
Okay, right. Okay, then we have this other category, other. And so a lot of it's, people contacting the line and they really wanted to know where, the birth control center was, or what is this continuing care resolution team? Just sort of just basic questions about that. Or, how does long-term care work? Then we've had some interesting ones, someone complaining about a noise in the back alley, which is of course a concern when you can't sleep. Or, we got an email from someone in Pakistan a couple of weeks ago, and, how could you help my client who's had brain damage? Yeah. So we've had some other. Just wanted to now talk to you a little bit about our work plan, and then we'd like to get your input. So we've kind of built our work plan around 3 pillars. So the first one is around patients, clients, family, and the public. The second one is around staff and providers, and the third one is around the system. So we'll talk about the patients, family, clients, and the public. People are saying, please, create some kind of a hub, some kind of a navigation system. We need to be able to understand how continuing care works. It's just a big black hole we don't understand. So that's one of the suggestions that people have given to us. Another recommendation that people have said we need to pay attention to is around robust communication. It's kind of getting the conversation out there, opening the kimono on continuing care. Start the conversation. The third one is the need to really expand family, caregiver, and volunteer support. We have many folks who are living at home, their spouse or their daughter or someone is helping to look after them. Often they don't even realize that home care services are available or that they could access respite care. So families are getting, to an exhaustion point, and we're not providing the appropriate support to help them. We need to optimize the client's potential. We need to streamline the concerns process. So, when we started this secondment, someone said to us, did you realize there are 24 ways to register a concern in continuing care? Well, we haven't been able to actually get the full list of 24, but I think it just basically illustrates that the public and families are confused. Who should I contact if I have a concern? And the last one is around the need to establish family advisory councils. We have met in one community in particular with a very energized family advisory council. I think that we could replicate that in many of our facilities and supportive living environments around the province so that families are able to be partners in care along with the providers. And I think that they can play a role too in helping us be accountable for the services that are provided.
So the next pillar is around staff and providers, and the first one that we've heard and we're suggesting is that we have to create some leadership capacity at the level of where the care is being provided. This does not mean we're adding another layer of management. What we're saying is that being able to support the registered nurse or the licensed practical nurse, whoever is kind of in charge of that area or that unit, and to ensure that they can respond to the needs and concerns of families, of the clients themselves, the residents, in a timely manner, and to build some leadership there that can also help with the coordination of care each and every day, 24/7. The next theme is around orientation. We had a lot of families and residents ask us, what is the type of education that staff receive on the importance of activities of daily living, on the importance of nutrition, on the importance of how to manage aggressive behavior in some of the cognitive impaired or dementia clients? What's really important? How do you deal with different cultural issues? And so forth and so on. So one of our suggestions is that we do some real investment in education and orientation. As you know, 70% of the care is being provided by healthcare attendants. And so we need to raise them up and make sure that we are giving them the tools. They've actually told us they would like to have more education and more orientation in some areas. And so we need to make that commitment to them. And then lastly, but not, and it goes back to, I think, John, your opening comments about we really do need to make a real concerted effort to really talk about person-centered care. And it can be patient-centered care, client-centered care, but really, no, it's about caring for the client or the resident or the patient or the family, not managing them. How do we care? How do we find out their story? How do we find out, what was your dad? Tell us about your dad, or tell us about your mom. Because that person, who they are, shapes how they also will journey, whether they have dementia or they're dealing with diabetes or chronic illness. So we really need to really pay attention. And I'm not sure if you're aware, but in Alberta Health Services, 2 of our executives are leading a Patient First initiative, and they are looking to seek input and suggestions around how we actually can make it very person-centered. The next one is around the system. And so we are suggesting that we really need to look at our coordination and our governance. And as Isabel said, we have a very confusing system. It's not real clear. And so we need to do some work to look at how we actually organize ourselves so that we can be responsive to your needs and the needs of the people of Alberta. We also are suggesting we really need to look at our quality assurance, quality improvement processes. So there are continuing care standards, and so how are we ensuring that we are auditing, looking at compliance, looking at where opportunities are, has the organization followed through with those opportunities, and so forth and so on. Innovation and technology. This is actually, I think, an exciting time for us, and Isabel can certainly add more to this area. But we need to look at new models of care, and we've actually been introduced, we were in Alberta, we didn't go overseas, but we've learned about some really fantastic models happening in the Netherlands and in the UK. And about really, just give you an example, in both the UK and the Netherlands, they actually have the staff eat with the residents, so they have their meals with the residents. They even prepare the meals in these home-like settings. They are just so in touch. Versus, there's a nursing station at the end of the hall, and all the rooms are at the other end. They really looked at how they built their infrastructures, but how they developed a model of care that really actually it's very family oriented. And again, we need to look at that. There's also fantastic technology that's happening right in Alberta around even home monitoring systems. So my mom lives in Saskatchewan. She's 88 years old. And I could actually set up through like a security system, similar to what we have in some of our homes, and I could be able to monitor her or know whether she got up, at what time she got up, and, has she fallen? And so there's just some fantastic work happening in Alberta, and we need to look at that. Then we need to look at delivery models to address care. We know that a one-size-fits-all model does not work. We've got very different levels of care and acuity happening across the province. So have we got the staffing model to match the care that is needed? Do we have the right number of LPNs, healthcare assistants, RNs? So how do we look at our delivery of model? Case coordination is another one. So we're suggesting that we need to look at the whole coordination. So some people have a case manager, and they can have multiple case managers as they move across the continuum of care. So how do we coordinate it so that you just have to phone me, and I'll deal with all the things behind the scenes so that you're not being passed off to multiple people. And then, last but not least, but engagement and transparency. Just what we're doing today, we need to ensure that we are out front talking about what we're working on, what's not working well, and we need your help, suggestions of how to fix it. How do we engage? We need to engage the people to help us find the answers to the questions that we have.
One thing under this theme too that people have said to us, you have all of these tools, you know, for assessment and placement. You need to be open about those tools. People need to understand how it works. We need to be transparent with our decision tools and our processes. I think this quote, I think, resonated with us. It came to us very early in the secondment, is that we work in the residents' home and they do not live in our workplaces. So I think if we can have everybody in Alberta Health Services thinking that, I think that will help to reframe. So what we were being told, we're coming to the end now, it's going to be turning over to you. We need the right capacity to support care needs. When you looked, we showed you that diagram at the beginning, and we have all those little boxes and whatnot. It's not as fluid as it needs to be, and we need to really follow the client's journey. We need to be the leader in this one. We need to ask you for your ideas and your opinions and suggestions on how things can be improved. I mean, people have come forward with amazing suggestions, and we know there are the answers out there. The time is now. I think also, even with the new Premier and the new Minister of Health, I mean, certainly this is a very topical area, and we need everyone. We need everyone. We're all going to be going through this journey ourselves. We've had parents and siblings and friends who have experienced continuing care. We all need to get on board. We need to help make the system the best that it can be. We feel that we have a window of opportunity. We need to really simplify and streamline. People are, as we mentioned, they're saying, this is too complex. Please, skinny it down. We need to be more proactive rather than reactive. And we need to ensure that continuing care is on everyone's agenda. We need to give it the attention that it deserves. We're being told that it's the fastest growing area of the health system. But when we look at agendas, we look at media releases, we look at the minutes that we circulate in continuing care, how much of the focus is that, or in Alberta Health Services, how much of the focus is on continuing care? So we need to shift that balance. And we need to keep that conversation alive. So we are going back to our regular positions in early January. We are creating a sustainability plan because we need to ensure that as we go forward, that people are going to pick up these pieces and move them ahead. We've got to get these things over the finish line. And just a little bit of levity. Actually, we were reading just recently an article from the BBC that even the Queen is being impacted by this aging population, and she sends out these letters, of congratulations when you reach 100, and there's been a 70% increase in the number of those letters that have gone out over the last decade. So Alberta is not the only area that's feeling the pressure. It's even the Queen. So I think we feel through the 4.5 months that we've been involved in this journey that there is hope, there is optimism, and we'd like to now ask you for your help. So what have you heard, and what have we missed?